All right, this is the second half of your urinary system lecture. This lecture is primarily going to focus on how the kidneys maintain their water balance and some of the illnesses and disease states that can happen in the urinary system. So the first thing we're going to look at, how do our kidneys maintain water balance? So one of the major functions of our kidneys and our urinary system in general, besides filtering the blood, is going to be to maintain our water balance. This is incredibly important in regard to keeping the homeostasis of the body in check. And the way that the kidneys do this is by using ADH, also known as antidiuretic hormone. This is going to be a hormone which is going to signal the kidneys to return more water into the blood. Alcohol and caffeine can kind of inhibit this hormone. This is why you have to pee a whole lot whenever you are using alcohol or caffeine. So the reason why this process is so important, or one of the many reasons why this process is so important, is because this is how we regulate our blood pressure and our blood volume. So you can see that as our blood pressure or blood volume starts to fall, the JG cells in the kidneys are going to release renin. This is going to lead to angiotensin II being formed in the blood, and this is going to eventually cause vasoconstriction and peripheral vascular resistance, and this is going to help to control that blood pressure. At the same time, our adrenal cortex is going to secrete aldosterone. This is going to target our kidney tubules, and this is going to cause sodium reabsorption, and since water always follows sodium, water absorption as well. And this is going to result in increases in blood volume and increases in our blood pressure. These hormones also act to inhibit the baroreceptors in blood vessels. So with this, we also end up with even more vasoconstriction. So this is going to increase that peripheral resistance. And then all at the same time, it's really interesting. We have all these processes kind of happening in synergy together. So our posterior pituitary is what is going to release initially this ADH hormone that again is going to act on those collecting ducts and increase that H2O or water H2O reabsorption. Sorry, I got all tangled up there. But I wanted to give you all the schematic. I know the schematic is a little bit complicated, but I just wanted you to see all of these processes that are all working in synergy to help control our blood volume and our blood pressure, because it is such an important process. Okay, so let's talk a little bit about what urine actually is. Urine is going to be the liquid byproduct of metabolism. It's going to contain water, urea, and other waste that are filtered out of the body by the kidneys. It's going to be about 95% water and about 5% solutes. It can contain up to 3,000 different chemicals that need to be eliminated from the body. So your hydration level can usually be determined by the color of your urine. Darker urine is going to indicate that our bodies are reabsorbing more water back into the blood because there isn't enough, whereas lighter urine indicates that we have plenty of water, so our kidneys are getting rid of the excess. Sometimes this can be changed depending on certain medications or foods, but this is one of the many things that they're looking at whenever they are looking at a urinalysis. So urinalysis is going to be a diagnostic test that is going to be used to analyze the chemical properties of urine. It can also be used to test for a variety of different diseases or disorders, or for the presence of certain drugs or toxins. So examples here, like a high hormone level of HCG can indicate pregnancy. Various drugs and medications can be present in urine. And excess nutrients or metabolic waste can also be detected in urine. So these urine tests can tell us a whole lot about how well a patient is doing. I do not need you to memorize this. I just wanted you to know what specific characteristics we're looking at whenever we're doing a urinalysis in medicine. So the reason why is because urine can help indicate whether there is a health problem. So we can have like white blood cells or pus in our urine. This can indicate a UTI or other infection. We can have sugar in our urine. We looked at this in lab. This can indicate diabetes. We can also have protein or albumin in our urine. This can be really important during pregnancy if we're looking at high blood pressure, if we're looking at kidney damage or heart failure or muscle breakdown. There's so many things that we are able to tell by the specific stuff that is in our urine. We can also have blood in our urine. This is called hematuria. This can also indicate an infection, kidney stones, or kidney or prostate disease. So let's talk a little bit about kidney stones. These are going to be hard deposits that are made of minerals and salt that form inside the kidneys. And we looked at how that can actually happen in those tubes on the last lecture. There are a few different risk factors for this: genetic predisposition, consistent dehydration, sometimes Crohn's disease, or if you have low dietary calcium or high dietary sodium, gout or diabetes. All of these things can contribute to the likelihood that you will get kidney stones. And kidney stones can be located all throughout the urinary tract. So here on the diagram, you can see a stone in the pelvis of the kidney. You can get stones in the ureter. So this can happen pretty much anywhere within the urinary system. Let's talk a little bit about kidney disease and failure. So kidney disease is going to be a loss of normal function of the kidneys. This can be either acute or chronic, meaning it can happen really slowly over time, or there can be some kind of precipitating event that makes it happen really, really quickly. We use a test to determine how well the nephrons of the kidney are filtering. This is called a glomerular filtration rate, or GFR test. The primary causes of kidney failure in the United States are going to be diabetes and high blood pressure, especially when you have those two things together. You can also have autoimmune diseases and genetic conditions that can lead to kidney failure. Dialysis is needed when the kidneys fail. So whenever the kidneys stop being able to do that job of cleaning the blood and keeping the necessary water and nutrient balance, we can use dialysis to do that process externally and then send the blood back in once it's all cleaned up. Usually this is required about 3 to 4 times a week. It usually takes about 4 hours at a time, so it is a very timely process for people that have kidney disease. The last thing that I want to talk about that your book touches on is polycystic kidney disease. We looked at an example of this in lab as well. This is going to be a genetic disorder that causes fluid-filled cysts to grow in the kidneys. The cysts are non-cancerous, but they can cause the kidney to grow extremely large and lead to high blood pressure and eventually lead to kidney failure, which can require a kidney transplant. So this is definitely something that starts small and can pretty quickly, over time, spiral out of control. That is all that I have for you on the second part of the urinary system lecture. If you have any questions or need any help with any of this content, just reach out.